Hello friends, I am Dr. Deepak Garg and today we will discuss the MCQ part of the bone tumors. So our first question is, epiphysis is involved in which bone tumor? A. Osteosarcoma, B. Multiple myeloma, C. Giant cell tumor, D. Ewing sarcoma. So the osteosarcoma, it is metaphyseal, Ewing sarcoma, it is diaphyseal, multiple myeloma, metaphyseal, diaphyseal. So the giant cell tumor is epiphyseal. So the answer is C. Giant cell tumor. Pollen fragment sign is seen in A. Aneurysmal bone cyst, B. Simple bone cyst, C. Giant cell tumor, D. Fibrous dysplasia. So this is a pathognomic sign of a simple bone cyst. So answer is B. Simple bone cyst. Then tumor with onion peel periosteal reaction. A. Osteosarcoma, B. Giant cell tumor, C. Ewing sarcoma, D. chondrosarcoma. So the most commonly the onion peel periosteal reaction is seen in Ewing sarcoma. So the answer is C. Ewing sarcoma. Then question number 4, most common site of osteosarcoma. A. Upper femur, B. Lower femur, C. Upper tibia, D. Lower tibia. So the most common site is around the knee and distal femur is more than proximal tibia. So distal femur is lower femur. So the answer is B. Lower femur. Most common tumor of bone of hand. A. Osteochondroma, B. Giant cell tumor, C. Enchondroma, D. Osteosarcoma. So the most common tumor of bone of hand is enchondroma. So the answer is C. Enchondroma. Then sunburst appearance is seen in. So the sunburst appearance is most commonly seen in A. Osteosarcoma, B. Ewing, C. GCT, D. Myeloma. So the answer is A. Osteosarcoma. Night pain relieved by aspirin. A. Osteosarcoma, B. Osteoid osteoma, C. Ewing sarcoma, D. Aneurysmal bone cyst. So this is a pathognomic sign of osteoid osteoma. So answer is B. Osteoid osteoma. Then question number 8, ground glass appearance is seen in A. Fibrous dysplasia, B. GCT, C. ABC, D. Myeloma. So the ground glass appearance is on X-rays is showing a fibrous lesion. So the answer is A. Fibrous dysplasia. Most common primary malignant bone tumor overall. So primary malignant bone tumor overall is A. Osteosarcoma, B. Multiple myeloma, C. chondrosarcoma, D. Ewing sarcoma. So all these are the malignant tumors and the most common primary malignant tumor overall is a multiple myeloma. So the answer is B. Multiple myeloma. Most common site of bone metastasis. Femur, tibia, vertebrae, skull. So the most common site is the spine and most common site are the vertebrae. And in vertebrae, thoracic spine more than lumbar spine. So the answer is C. Vertebrae. Metaphyseal tumors among the following. So which of these is metaphyseal tumor? Osteosarcoma, B. Ewing sarcoma, multiple myeloma, or lymphoma. So osteosarcoma is metaphyseal, Ewing sarcoma is diaphyseal, multiple is metadiaphyseal, and lymphoma diaphyseal. So the answer is A. Osteosarcoma. Diaphyseal tumor most commonly. So which of these is diaphyseal? A. GCT, B. Osteosarcoma, C. Ewing sarcoma, D. chondroblastoma. So GCT is epiphyseal, osteosarcoma is metaphyseal, Ewing sarcoma is diaphyseal, and chondroblastoma is epiphyseal. So the answer is C. Ewing sarcoma. Epiphyseal tumor before skeletal maturity. So before skeletal maturity epiphyseal, the answer is A. GCT, B. chondroblastoma, C. osteosarcoma, D. ABC. So GCT is after skeletal maturity, so ruled out. Chondroblastoma is before skeletal maturity and in the epiphysis, so answer is B. Osteosarcoma is metaphyseal ABC is metaphyseal and after skeleton 11 to 20 years. So it is not epiphyseal. So the answer is B, chondroblastoma. Most common benign bone tumor: osteosarcoma, osteoid osteoma, osteochondroma, enchondroma, or GCT. So most common benign bone tumor is osteochondroma, B. Most common true benign bone tumor: osteochondroma, fibrous cortical defect, osteoid osteoma, or enchondroma. So in the last question, our most common benign tumor was osteochondroma, but that is a developmental anomaly. That is not a true benign tumor. So this is cannot be a true benign tumor. So the true benign tumor most common is osteoid osteoma. The answer is C, osteoid osteoma. Soap bubble appearance is seen in A, osteosarcoma, B, GCT, C, Ewing sarcoma, D, myeloma. So the answer, soap bubble appearance is seen in, we already know, answer is GCT, giant cell tumor, B. So because it produces an expansile lytic lesion that gives an appearance of a soap bubble appearance. Punched out lesions in the skulls are seen in Ewing sarcoma, osteosarcoma, multiple myeloma, A, B, C. So the answer is multiple myeloma. That is a pathognomic sign of most commonly seen in a multiple myeloma. Cartilage cap thickness more than 2 cm suggests benign osteochondroma, malignant transformation, fibrous dysplasia, ABC. So this is seen in cartilage cap thickness. When we talk about cartilage cap thickness, we are talking about osteochondroma, and cap thickness more than 2 cm is suggestive of malignant transformation. So the answer is B, malignant transformation. Most common malignant tumor of hand bones. So they are asking about malignant tumors, not benign tumor. A, osteosarcoma, B, enchondroma, C, chondrosarcoma, D, GCT. So the most common tumor of the hand is enchondroma, B, but most common malignant tumor of the hand is C, chondrosarcoma. C, chondrosarcoma. So the most common is chondrosarcoma. Radio-resistant bone tumor: A, Ewing sarcoma, B, osteosarcoma, C, lymphoma, D, myeloma. So these all three, A, C, and D, are radio sensitive. Only osteosarcoma is radio resistant. So answer is B, radio resistant tumor is osteosarcoma. Most common site of osteosarcoma: distal femur, proximal humerus, distal tibia, pelvis. So we already have discussed this question. Answer is A, distal femur. Most common tumor in first decade of life: osteosarcoma, Ewing sarcoma, chondrosarcoma, myeloma. So less than 10 years of the age, most common malignant tumor is Ewing sarcoma. So youngest malignant tumor is Ewing sarcoma. So the answer is B, Ewing sarcoma. Ground glass appearance on X-rays suggest. This is again a repeat question. Answer is A, fibrous dysplasia. Tumor associated with translocation 1122. So this is a pathognomic. This tumor is characterized by this translocation, and answer is Ewing sarcoma. Past positive tumor cells are seen in. So again, past positive is seen in which tumor? So the tumor cells which will contain the glycogen will be past positive, and the answer is B, Ewing sarcoma. Most common site of chondrosarcoma: so chondrosarcoma, axial more than appendicular, axial more than extremities. So let's see, pelvis is axial, all three are extremities. So the answer is A, pelvis. Epiphyseal tumor after skeletal maturity: So after skeletal maturity, epiphyseal tumor is chondroblastoma is before skeletal maturity, osteosarcoma is metaphyseal, Ewing sarcoma is diaphyseal, GCT is epiphyseal after skeletal maturity. So answer is B. Double density sign on bone scan is seen in. So the answer is osteoid osteoma, because in osteoid osteoma there is a intense focal uptake with surrounding lesser uptake, so that appears as a double density sign. So that is a sign of osteoid osteoma on bone scan. So answer is B. Most common site of bone metastasis. So repeat question, answer is A, vertebrae. Osteoblastic metastasis is classically seen in. Osteoblastic metastasis means the bone forming metastasis is seen in lung cancer, breast cancer, prostate cancer, renal cancer. The answer is C, prostate cancer. Typically, the most of the metastases are osteolytic. If you are osteoblastic and prostate forms the osteoblastic metastasis, so answer is C, osteoblastic. It causes a sclerotic bone, not lytic bone. Most common benign tumor of small bones of hand. So they are now asking benign tumor. So we know that the most common benign tumor of the small bone of the hand is enchondroma. Answer is B. Egg cell crackling is classically seen in. So when we palpate, we feel that like an egg cell, and when we feel the crackling like egg cell, so this is a sign of giant cell tumor, because when it leads to the expansile cortex, and the cortex is thinned like a egg cell, and when we palpate it, we feel like the crackling like a egg cell. So the answer is B, GCT. Most common tumor around knee joint. So osteosarcoma, Ewing sarcoma, GCT, myeloma. So we know that the osteosarcoma and Ewing sarcoma, they at the most common location, and GCT, the most common location is around the knee. But out of these three, which is more common? Is answer is GCT, C. Most common cause of bone metastasis in females. Cause of bone metastasis: lungs, breast, thyroid, or colon. Means which of these tumors will most commonly will come to bone. So we already know that colon rarely go to the bone, but these three are the commonly. They are specifically asking about the female. So the breast is the most common tumor metastasized to bone. So the answer should be B, breast. Most common cause of osteolytic expansile metastasis. Osteolytic expansile metastasis. Now they are asking about osteolytic. So prostate is sclerotic, it is ruled out. Then breast, renal cell carcinoma, lungs. So breast can be both lytic and sclerotic, but renal is always lytic. And lung can be, few varieties in the lung can be lytic or sclerotic. So the answer is C, renal. Marrow based tumor among the following: osteosarcoma, Ewing sarcoma, osteoid osteoma. So we know that these are arising from the bone. Ewing sarcoma is a marrow based because it arises from the marrow cells. So the answer is B, Ewing sarcoma. Most common true benign bone tumor. So they are asking benign bone tumor and true. So it cannot be osteochondroma because it is not a true benign tumor. It is a developmental anomaly. The answer is B. We have already seen. Repeat question. Most common primary malignant bone tumor overall. So they are asking malignant bone tumor. They are asking primary. Repeat question. Multiple myeloma. C. Most common site of chordoma. Chordoma, most common site is sacrum. Answer is B, because it arises from the notochord remnants. So the most common site is sacrum. Ficelliferous cells are seen in. Ficelliferous cells are seen in. The answer is C. Chordoma. Beveled edge skull lesion is seen in multiple myeloma, eosinophilic granuloma, osteosarcoma, metastatic. So the skull lesions, if we look at the skull lesion, it is seen in the multiple myeloma, it is seen in the eosinophilic granuloma, not in the osteosarcoma and metastasis. Not so. Answer should be either A or B. And then beveled edge skull lesions. So the multiple myeloma is punched out lesions, and the beveled edge as in the eosinophilic granuloma. It is also called as Langerhans cell histiocytosis, and it produces a beveled edge skull lesion. So LCH or eosinophilic granuloma are the should be the answer. So answer is B. Shepherd crook deformity is seen in. So the femur become like a shepherd crook. So the answer for this question is fibrous dysplasia. This is a characteristic deformity seen in the fibrous dysplasia. Rind sign is a characteristic of. Again, rind sign is the lytic lesion is surrounded by sclerotic lesion, and there are multiple lytic lesions. So again, this is a characteristic sign of a fibrous dysplasia. Chicken wire calcification is seen in. So chicken wire calcification is seen in. This is because of pericellular calcification that is seen in chondroblastoma. So this is a epiphyseal lesion. Usually this is, if this is a growth plate and this is the epiphysis, so this is usually the epiphysis lesion, and there will be a chicken wire appearance of calcification. That is a characteristic sign of a chondroblastoma. Most common malignant tumor of sacrum is, we have already repeat question, this is a chordoma. So the chordoma is most commonly seen in the sacrum, and the most common malignant tumor of the sacrum is chordoma. Crab features are seen in. C for hypercalcinosis, A for anemia, B for lytic lesions in the bone, and R for renal dysfunction. So crab. So crab is seen in multiple myeloma. Onion skin periosteal reaction typical of Ewing sarcoma. Codman's triangle typically seen in, so it is seen in malignant tumor, and most common is osteosarcoma. Commonly seen, that is most commonly seen in osteosarcoma. Most common site of metastasis in skeleton. Repeat question. A, vertebrae. CD99 positivity is characteristic of. So CD99 is a immunohistochemistry marker, and it is, we get this staining CD99 or MCQ2. It is, so these are done in Ewing sarcoma. So Ewing sarcoma, please remember, PAS positive, CD99, MCQ2, translocation 1122. So these are all the questions from Ewing sarcoma. Most common site of aneurysmal bone cyst: distal femur, proximal tibia, pelvis, or vertebral posterior elements. So it is most commonly involves the metaphyseal long bone and vertebral posterior element. So in this from this question, it is C, vertebral posterior element. Fluid field level on MRI are characteristic of. So the fluid field level are characteristic of any cyst. Either this is ABC or SBC. So from the options we have only ABC. So the answer is aneurysmal bone cyst. Most common benign tumor overall is, so we don't have osteochondroma. So in the option, so we have this osteochondroma, sorry. So the answer is B, osteochondroma. Most common cause of pathological fracture in children: GCT, osteosarcoma, simple bone cyst. So they are asking in children. So the most common tumors in children are we can say it is in malignant, it is osteosarcoma, and benign is a simple bone cyst. Simple bone cyst is much more common than osteosarcoma. So the answer should be C, simple bone cyst. Most common malignant tumor in adolescents. So after, we can say 11 to 20 years from our last video about the bone tumor, most common malignant bone tumor in adolescent. So the most common tumor in this age group is which tumor? Osteo, Evo, Ewing sarcoma, myeloma, or chondrosarcoma. Chondrosarcoma is seen in the adults after the age of usually 35-40 years. Same for the myeloma. So either this is osteosarcoma or Ewing sarcoma. So the Ewing sarcoma is more common in less than 10 years of age. From 11 to 20, osteo is more common than Ewing. So the answer should be A, osteosarcoma. Most common primary for osteoblastic metastasis. Repeat question, C, prostate. Bone scan is often negative in. So bone scan will show uptake by the osteoblast osteocytes. So osteosarcoma is a tumor from the bone. So it should be positive. Even Ewing sarcoma should be positive. GCT again in the bone, but multiple myeloma lacks osteoblastic response, and bone scan may be negative. It may be positive, but it may be negative. So the answer is C, multiple myeloma. Most common tumor of mandible. So the most common tumor of mandible is not GCT, not osteosarcoma. It is squamous cell carcinoma, SCC. Most common long bone affected in adamantinoma is tibia. We have to remember this. Adamantinoma most commonly affects tibia diaphyseal. So it affects diaphyseal, not metaphyseal, not epiphyseal. Osteoid matrix formation is diagnostic of, means any tumor which is forming osteoid matrix. That means any tumor which is forming bone. So the bone forming tumor is osteosarcoma, because these are the bone forming tumor, because these are primarily from the osteocytes. So they are the bone forming tumor. Then most common site of giant cell tumor. It is proximal humerus, distal femur, pelvis, or skull. So it is most commonly around the knee. So the distal femur more common. So the answer is B, distal femur. Most common tumor of vertebral posterior element. Osteosarcoma, ABC, GCT, myeloma. Answer is, we have a repeat question, B, ABC. Tumor with popcorn calcification. So we talk about calcification. That means we are talking about a chondroid tumor. So we have to see which out of these is a chondroid. So C is a chondrosarcoma. It is a chondroid tumor. Answer is C. Most common site of Ewing sarcoma. So Ewing sarcoma happens in the diaphysis, and the most common site is around the knee, distal femur more than proximal tibia. So here we have the shaft of the femur, distal tibia. Distal tibia is we see the most common location is diaphysis. So they are asking shaft of femur. So that should be the answer. Answer is B, shaft femur. Most common tumor in elderly with bone pain. So again the answer is multiple myeloma. Most common bone tumor is multiple myeloma. Most common site of metastasis from the breast carcinoma. So the most common site of from the breast is in the bone is spine. Repeat question. Most common benign tumor in children. So they are asking in children less than 12 years of age, and benign tumor, not malignant. So osteochondroma, GCT. So answer should be A, osteochondroma, because it is the most common tumor and it happens in the developing age group in children. So answer is A. Tumor associated with hyperglycemia. Hyperglycemia. So this is a very you can remember this. Sometimes chondrosarcoma is associated with hyperglycemia. So it is finding. So answer is chondrosarcoma, B. Most common malignant tumor of pelvis. So for chondrosarcoma, most common location is axial. For osteosarcoma, the most common location is extremity, distal femur more than proximal tibia. GCT, distal femur more than proximal tibia. Ewing sarcoma is again soft femur. So the answer should be B, chondrosarcoma. Most common, most important prognostic factor in osteosarcoma: age, tumor size, metastasis, gender. So these are all the prognostic factors, but if there is already a metastasis present, that becomes the most significant factor. So answer should be C. Most common site of simple bone cyst: distal femur, proximal humerus, vertebra, pelvis. So this is usually seen in the epiphysis before the epiphyseal closure, 0 to 10 year of the age group, and the most common location is proximal humerus. So the answer should be B, proximal humerus. Most common cause of osteolytic bone metastasis. So this is again a repeat question, RCC. Most common bone tumor overall: osteochondroma, metastasis, myeloma, or osteosarcoma. So they are asking overall. So in any, considering all the age group, so they are not asking any benign or malignant bone tumor, but overall if we look, if there is a option of metastasis, then metastasis overall is most common. So the answer is B, metastasis. Most common primary tumor metastasizing to bone in males is prostate, lung, kidney, colon. So the answer is B, prostate. It is the most common to metastasize. In female it is breast, in male it is prostate. It is very easy to remember. Most common primary tumor metastasizing to bone in female. So answer is breast. Tumor producing malignant osteoid means the bone forming tumor. So which of these is bone forming tumor? Again osteosarcoma, repeat question. Answer is C. Tumor commonly associated with Olier's disease means multiple enchondromas. Multiple enchondromas are Olier's disease. So answer is B, enchondroma. Enchondroma with hemangioma is called. So this is a complex association, and this answer is Maffucci syndrome, B. So enchondroma with hemangioma is called Maffucci syndrome. Most common bone involved in fibrous dysplasia. Again the answer is B, femur. Stafford Crook deformity is seen in femur, and the most common bone involved is femur. We can remember by this. Most common site of chordoma: sacrum, but sacrum is not in the options. Frontal bone: clivus. Clivus is at the base of the skull. Temporal bone: parietal. So they are asking from the all the bones of the skull. So the most common location out of these is clivus, that is the base of the skull, because the notochord remnant, this tumor arises from the notochord remnant, and the clivus is the is the common skull site. Most common site of osteoid osteoma. So the answer should be it is a diaphyseal tumor. So we should first look which is the diaphyseal, so the shaft of the femur. So B is the most common site, shaft of the femur. Most sensitive imaging for nidus detection. So most sensitive out of the four is MRI, X-ray, CT, ultrasound. So we always get CT so that we can see the lytic followed surrounded by the sclerotic lesion, that is most commonly seen in CT. So the most sensitive is CT. Most common site of chondroblastoma. So we already know chondroblastoma, 0 to 10 year of the age group, most common epiphyseal location, and so the most common location is around the knee, distal femur more than proximal tibia. Answer is A, distal femur. Most common cause of vertebral collapse in elderly. So answer, most common means the most common tumor is metastasis, and the most common cause of collapse in spine should be metastasis. The answer is C, metastasis. Most common tumor associated with pathological fracture in adults. So now the answer is, question is asking adults. So it should be the most common tumor, that is should be the most common associated with pathological fracture. So the myeloma GCT age group is after the physeal closure, myeloma after the age of 35 years, osteosarcoma after 10 to 30 years, you can say, or 10 to 20 years. ABC is 10 to 20 years. So the most common in adults is, out of these, the which will cause the pathological fracture is myeloma. Answer is B, myeloma. Most common bone tumor in 20 to 40 age group is osteosarcoma, GCT, Ewing sarcoma, myeloma. The answer is B, GCT. Osteosarcoma is early, less than 20 years. Ewing is less than 20 years. Myeloma is after the 40 years. So 20 to 40 most common is GCT. Most common site of secondary chondrosarcoma. Site of secondary chondrosarcoma. It is pelvis, distal femur, tibia, humerus. So the primary chondrosarcoma is axial, and secondary osteosarcoma is again axial. So the chondrosarcoma, whether this is primary or secondary, it is the most common location is axial location, and out of these only pelvis is the axial. So the answer is A, pelvis. Most common tumor in sacrum, chordoma. Repeat question. Most common benign epiphyseal tumor. So GCT is epiphyseal, chondroblastoma is epiphyseal, osteosarcoma is metaphyseal, ABC is metaphyseal. So answer is either A or B. Now out of the two, is which is most common? B, chondroblastoma. It occurs before the skeletal maturity, and this is the most common benign epiphyseal tumor. Most common primary bone malignancy in children. So they are asking in children primary bone malignancy. So the answer is osteosarcoma. If they ask less than 10 years, most common it is Ewing sarcoma. If they ask 0 to 20 years, most common it is osteosarcoma. If they ask 10 to 20, most common it is osteosarcoma. Most common tumor causing egg cell crackling, GCT. Repeat question. Most common cause of lytic skull lesions in elderly, multiple myeloma. Repeat question. Tumor that stops growing after skeletal maturity, osteochondroma. Repeat question. Most common tumor in diaphyseal of tibia. So osteosarcoma is metaphyseal, Ewing sarcoma is diaphyseal, GCT is epiphyseal, myeloma is metadiaphyseal. So the answer is B, Ewing sarcoma, because that is the only diaphyseal tumor here. Most common tumor associated with Maffucci syndrome. So enchondroma plus hemangioma is Maffucci syndrome. So answer is B. Most common bone tumor in axial skeleton. It should be chondrosarcoma, but that is not in the options. So osteometastasis, GCT, Ewing. Osteo most common is distal femur more than proximal tibia. Metastasis is most common in the spine, that is in the axial skeleton. GCT is epiphysis, Ewing sarcoma is diaphysis. Answer should be B, metastasis. Most common tumor showing Codman's triangle. So that is aggressive periosteal reaction shown by malignant tumors. The most common is osteosarcoma. Answer is B, osteosarcoma. Most common tumor producing fluid level. So when we talk about fluid level, we talk about cyst in the bone, and out of the options only ABC is the cyst. Answer is A, ABC. Most common malignant cartilage tumor. So they are asking malignant cartilage tumor. So chondrosarcoma is a malignant cartilage tumor. Answer is C, chondrosarcoma. Most important investigation for diagnosing multiple myeloma. X-ray, CT, serum electrophoresis, bone scan. Answer is C, serum electrophoresis. It will have a M protein M band that confirms plasma cell dyscrasia, and this is a diagnostic for multiple myeloma. If we get this, we do not even repeat the biopsy for proving multiple myeloma or plasmacytoma. Most common tumor in epiphysis after skeletal maturity. So after skeletal maturity is GCT. Most common tumor in epiphysis before skeletal maturity is chondroblastoma. Most common tumor showing sunburst is osteosarcoma. Most common tumor with laminated periosteal reaction, that is laminated periosteal reaction means onion peel reaction, Ewing sarcoma. Most common tumor associated with pathological fracture in hand bones. Most common tumor, not malignant tumor. So the most common tumor in hands is enchondroma, and that will be the most common cause of pathological fracture. Most common tumor involving sacrum is chordoma. Most common tumor involving sacrum in young adults. So they are asking young adults. Chordoma is a disease of after 40 years. So the young adults, it is not chordoma. I'm really sorry. The answer is in young adult, answer is GCT, because that is 20 to 40 years. Most common primary malignant bone tumor in adults. They are asking now primary malignant bone tumor in adults. So the answer is multiple myeloma. If the question was about the children, it should be osteosarcoma. Now they are asking adults, then it is multiple myeloma. Most common site of osteosarcoma, distal femur metastasis. So the osteosarcoma, Ewing sarcoma, chondrosarcoma, GCT, the most common site of metastasis is lung. So the answer is C, lung. Most common cause of osteoblastic vertebral lesion. Now again, osteoblastic means bone forming sclerotic lesion, that is most commonly a metastasis from the prostate. B. Most common tumor presenting with night pain, osteoid osteoma. It is again pathognomic. Repeat question. Most common tumor causing soap bubble appearance. So again, soap bubble appearance is GCT. Most common tumor of diaphyseal in children. Osteosarcoma is metaphyseal, Ewing sarcoma is diaphyseal, GCT is epiphyseal, and chondroma is diaphyseal, metadiaphyseal. The answer is D, B, Ewing sarcoma. Most common tumor with ground glass X-ray appearance, fibrous dysplasia. Most common tumor associated with secondary chondrosarcoma. So again, which tumor will convert into secondary osteosarcoma? This is what they are asking. So osteochondroma is the most common primary tumor that will convert into chondrosarcoma, that is secondary osteosarcoma. Answer is A. Most common site of osteosarcoma in children, distal femur. Most common tumor presenting with raised ESR and fever, that is a systemic. They are asking about the systemic signs. So Ewing sarcoma is a systemic disease because it arises from the marrow based cells. So it is Ewing sarcoma which will produce the systemic symptoms. So B, Ewing sarcoma should be the answer. Most common malignant bone tumor in elderly. So it is metastasis. Most common tumor showing endosteal scalloping. So mostly chondroid tumors show endosteal scalloping, and it is chondrosarcoma in our options. Most common tumor of proximal humerus in children, simple bone cyst. It is most common in proximal humerus and the most common tumor of the proximal humerus. Most common primary tumor causing osteolytic spinal metastasis. So prostate will cause sclerotic. Lung, kidney and thyroid all will produce osteolytic, and out of which the most common is renal. Most common site of primary osteosarcoma, distal femur. Most common tumor showing permeative pattern of X-rays. Permeative pattern means aggressive lesion, means malignant lesion. So out of these, D is the B is the only malignant lesion. They are all three are benign. So answer is B. Most common tumor with cartilage cap is osteochondroma. Most common tumor associated with secondary aneurysmal bone cyst. They are asking secondary aneurysmal bone cyst. So some tumor converted into aneurysmal bone cyst. So GCT, osteosarcoma, myeloma, osteoid. The answer is A, GCT. So GCT can convert into ABC, that is called secondary ABC. Most common malignant tumor of axial skeleton. So metastasis and chondrosarcoma, these are seen in the axial skeleton, out of which is more common is metastasis. So answer is B. Most common tumor presenting with pathological fracture in proximal humerus. Most common tumor presenting with pathological fracture in, so most common tumor of the proximal humerus is SBC, and so the most common presentation will with pathological fracture will be SBC. Answer is B. Most common tumor with H3F3A. We have to remember this. This is a IHC marker for GCT. So if this mutation is present, that is a sign of GCT. So we get this IHC to confirm that this is GCT. So answer is GCT. Most common malignant tumor of cartilaginous origin. So they are asking cartilaginous means chondro, and malignant means sarcoma. So the answer is chondrosarcoma. C. Most common tumor showing Chinese letter pattern. Chinese letter pattern on histology. So the answer is A. This is how we identify the fibrous dysplasia on histopathology. So it shows Chinese letter pattern on histology. This is because of the irregular woven bone trabeculae that resembles Chinese letter. Most common tumor associated with lung cannonball metastasis. Lung cannonball appearance of metastasis in osteosarcoma. Most common tumor showing subchondral bone involvement. Osteosarcoma, giant cell tumor, Ewing sarcoma, myeloma. So the GCT is mostly epiphyseal tumor, and it will show the subchondral bony involvement. So answer is B, GCT. Most common tumor associated with secondary osteosarcoma. So some tumor converting into osteosarcoma. So which is that tumor which converts into osteosarcoma? Paget's disease, enchondroma, ABC, or osteoid. So the answer is Paget's disease. Paget's disease is known to cause osteosarcoma, and it may lead to secondary osteosarcoma. So answer is A, Paget's disease. Most common site of adamantinoma, already know, tibia and diaphyseal. So the answer is B, tibia diaphyseal. Most common tumor with cortical thickening, not thinning, and nidus. So the nidus is seen in osteoid osteoma. Answer is B. Most common tumor causing scoliosis in child due to pain. So tumor leading to the spine deformities. So osteosarcoma, osteoid osteoma, Ewing sarcoma, GCT. So it should be a tumor which is, they are asking due to pain, not due to the involvement of the bone. It is scoliosis due to the pain. So the answer is osteoid osteoma because it has severe pain. Most common tumor with Haversian system destruction. So the normal bony system is Haversian system. Which tumors destroy the Haversian system? Ewing, osteo, GCT, or enchondroma. The answer is Ewing because this is a marrow based tumor. Others are tumor from the bone. So it is a marrow based tumor. So it arises, gives an aggressive permeative destruction, including the Haversian system. So it destroys the Haversian system. It gives a permeative appearance. Most common tumor associated with cafe au lait spots is fibrous dysplasia. Most common tumor with thick cartilage cap in adults, suggesting malignancy, osteochondroma. Most common tumor with lytic expansile vertebral lesion and posterior elements involvement. So the posterior elements are involved. Lytic vertebral expansile lesion. Answer is C or B. AGCT, B ABC, C myeloma, D osteosarcoma. So the vertebral involvement, the most common tumor was, we have seen multiple times, it is ABC. With posterior, most common site is the posterior involvement. So the answer is B, ABC. Most common tumor with monoclonal gammopathy. So multiple myeloma, it is a M band positive monoclonal gammopathy. Most common tumor with sun ray appearance is osteosarcoma. Most common tumor involving metaphyseal. Ewing is dia, osteo is meta, GCT is epi, chondro is epi. Answer is B. Most common tumor producing punctate calcification. Calcification means chondroid tumors, so chondrosarcoma. Most common tumor in vertebral body of elderly with anemia. So they are asking anemia. So C, R, A, B we have previously seen. This is seen in multiple myeloma. Most common tumor with double density sign on bone scan. So we have already seen double density sign is a sign of osteoid osteoma, because there is a sclerotic lesion and it is surrounded by the lytic lesion. So the central dense uptake is surrounded by a lesser uptake. There will be a dense uptake surrounded by a lesser uptake. That is your double density sign on bone scan. That is osteoid osteoma. Most common tumor associated with diaphyseal, lytic lesion and fever. Systemic sign, diaphyseal, lytic lesion, Ewing sarcoma. Most common tumor with cortex and medulla continuity on X-ray. Means they are involving the medullary cavity and the cortex. Most common tumor with cortex and medulla continuity. Okay. They are asking that this is the cortex and the tumor is arising in continuity with the bone, and the answer is osteochondroma. Most common tumor causing endosteal scalloping is a cartilaginous tumor, that is a chondrosarcoma in these options. Most common tumor associated with H3F3, we have already seen GCT. Most common malignant bone tumor overall is metastasis, D. So guys, this was about the tumor cases, that questions that we have discussed. So now we will go next to our next topic in the next video. Please like, share and subscribe to our channel for more such videos. Thank you very much.